I think particularly on this vaccine debate, and there obviously is a lot about it, and as you rightly said, it is a very impressive development on the one hand, but I do think we also have to contextualize things a little bit and relativize them. This is not all about vaccine as a silver bullet. That is not the solution. I think what is most interesting here, and I think again we can, when we look at history and history of pandemics, what these kind of health crises, as we could call them, what they often do is they exacerbate and throw into relief existing social, economic, and political tensions. They highlight injustices more than anything. And they can, in some cases, examples are the cholera epidemic in places in Europe in the 19th century and other examples, they can lead to positive change and improvements. So just to focus now on vaccines and vaccine distribution, vaccine effectiveness, in a sense would narrow our perspective to potentially too far. We need to make sure, I think, to keep the bigger picture in perspective. What actually has this pandemic shown us about our way of living, how we live as a world community or family of nations, how we treat each other. I think those kind of the questions, they are fundamental questions about us individually and collectively, how nation states operate between each other. And Nita was saying that. I cannot emphasize it too strongly. International collaboration, international organizations, they have been enormously weakened over the last two decades. Now, if you look at the funding of something like the World Health Organization, which is, it's partly funded by the Gates Foundation, it's partly where people are on soft money, and partly by nation states. But if you would look at the actual amount, it's probably less than a day's work of Mr. Bezos. It is pitiful. And so it raises questions about we as a world community are basically set up for events like that. Those are the bigger question. And Nita was saying that we need to look at it in the perspective of access to medicine, access to healthcare. And I think those are the bigger questions. We need to look at broader questions of inequality, opportunities in education. All those are the bigger questions in which all this is actually part of the story. And I think that we should not forget about it. And the final point is there are countries in the developing world which actually have responded quite well, and that to the pandemic without enormous resources. Why? Because they had experiences of the epidemics and they learn lessons from it, because much of what we're talking about are issues about basic hygiene, basic issues of public health, and these kind of issues, they have learned the lessons to implement quickly. And actually it's not only about resources and vaccination distribution, it's a much bigger issue here, which we are addressing when we're actually moving away from just our Western perspective.